Heart disease isn't always loud and obvious. It doesn't always come with chest pain or dramatic heart attacks like in the movies. Instead, it often whispers, subtle signs, dismissed as something minor, until it's too late. Most people ignore these clues, thinking they're unrelated to their heart health. But what if recognizing these signs early could save your life? In this video, we'll uncover the most ignored symptoms of heart disease and empower you with the knowledge to protect your heart. Welcome to Levitas. Can it develop without obvious symptoms? Yes, heart disease can develop silently without any obvious symptoms, a condition known as silent ischemia. This happens when reduced blood flow to the heart doesn't cause noticeable pain or discomfort. Silent heart disease is often linked to risk factors like high blood pressure, diabetes, or elevated triglyceride levels, which slowly damage arteries over time. Stress and genetics also play a role, making it harder to detect. Many people only discover they have heart disease after a major event like a heart attack. The lack of symptoms makes regular health checkups crucial for identifying underlying issues early. What are the subtle signs people usually dismiss? Heart disease often presents itself through subtle signs that are easy to overlook. One common symptom is shortness of breath during mild activities, which many attribute to aging or being out of shape. Chest discomfort, like mild pressure or tightness, might be dismissed as indigestion or muscle strain. Similarly, swelling in the ankles or feet, a sign of fluid retention from poor heart function, is often blamed on long periods of standing or heat. Another ignored clue is jaw, neck, or shoulder pain. Unlike the classic chest pain, these symptoms are less understood and might not immediately raise alarm. Nausea, dizziness, and cold sweats can also signal heart trouble but are frequently mistaken for less serious conditions like dehydration or anxiety. Heart palpitations or irregular heartbeats, which can feel like fluttering or skipping, are often brushed off unless they're severe. Lastly, mild fatigue or feeling unusually tired after normal activities is often rationalized as a lack of sleep or stress. These symptoms are dismissed because they don't align with the dramatic portrayal of heart disease. Recognizing these subtle signs and linking them to heart health is vital for timely intervention and prevention of severe complications. Is snoring linked to heart disease? Snoring might seem harmless or just a nuisance, but it can be a red flag for a serious condition called obstructive sleep apnea, also known as OSA, which is strongly linked to heart disease. OSA occurs when the airway becomes partially or completely blocked during sleep, causing interrupted breathing and poor oxygen delivery to the body. This triggers a stress response, leading to spikes in blood pressure and heart rate. Over time, these fluctuations strain the cardiovascular system, increasing the risk of hypertension, arrhythmias, heart attacks, and even strokes. People with OSA often wake up feeling tired despite a full night's sleep, as the quality of their rest is compromised. Snoring is one of the most common signs of OSA, particularly when accompanied by choking or gasping sounds during sleep. OSA also causes oxidative stress and inflammation, both of which can damage blood vessels and promote atherosclerosis. Unfortunately, many people dismiss snoring as normal or joke about it, missing the opportunity to address a potentially life-threatening condition. If you or someone close to you snores loudly or has other symptoms of OSA, seeking medical evaluation can reduce heart disease risks and improve overall health significantly. Can unexplained fatigue signal heart issues? Fatigue is one of the most overlooked symptoms of heart disease. While it's easy to attribute tiredness to stress, lack of sleep, or a busy schedule, unexplained and persistent fatigue can be a warning sign of poor heart function. The heart's job is to pump oxygen-rich blood to tissues and organs, and when it struggles to keep up, energy levels plummet. One common cause is heart failure, where the heart's reduced efficiency leads to inadequate blood flow, leaving muscles and tissues deprived of oxygen and nutrients. Even tasks as simple as climbing stairs or carrying groceries can feel exhausting. Fatigue is also common in coronary artery disease, as narrowed arteries reduce blood supply, forcing the heart to work harder. Hormonal changes due to poor heart function can exacerbate fatigue. For instance, a struggling heart triggers the release of stress hormones like adrenaline, which initially compensate for reduced output but ultimately wear the body down. People often dismiss this type of tiredness because it develops gradually and doesn't seem urgent. If fatigue persists despite rest and isn't explained by lifestyle factors, it's crucial to consult a doctor to rule out heart-related causes and address the issue promptly. Why are women's heart disease symptoms often missed? Women often experience heart disease symptoms differently than men, leading to frequent misdiagnoses or delays in treatment. Instead of classic chest pain, women may feel discomfort in the back, neck, jaw, or stomach, along with nausea, fatigue, and shortness of breath. These atypical signs are often mistaken for less severe conditions like acid reflux, anxiety, or menopause-related issues. Hormonal differences also contribute to unique symptom presentations. The perception that heart disease primarily affects men further compounds the issue, causing many women to overlook or underreport their symptoms. Awareness and advocacy are essential for timely diagnosis and treatment in women. Does heart disease cause memory problems? Yes, heart disease can contribute to memory problems and cognitive decline. The brain relies on a steady supply of oxygen-rich blood to function, and any disruption in blood flow caused by heart conditions can impair mental processes. Atherosclerosis, or the buildup of plaque in arteries, can reduce blood flow to the brain, leading to subtle but significant changes in memory, focus, and decision-making. Heart failure can also exacerbate cognitive issues. When the heart is unable to pump blood efficiently, it deprives the brain of oxygen and nutrients, increasing the risk of vascular dementia. Additionally, irregular heart rhythms like atrial fibrillation can lead to blood clots that may travel to the brain, causing strokes or transient ischemic attacks, also known as mini-strokes, that damage cognitive areas. Inflammation and oxidative stress, often associated with heart disease, can further harm brain cells and promote the development of Alzheimer's disease. The connection between heart and brain health is undeniable, emphasizing the importance of managing cardiovascular risk factors not only for physical well-being but also for preserving memory and cognitive function as we age. When should you see a doctor for these symptoms? It's essential to see a doctor if you experience any of the symptoms discussed, especially if they persist or worsen over time. Shortness of breath, unexplained fatigue, or swelling in the ankles could signal underlying heart issues and shouldn't be ignored. Pay attention to recurring chest discomfort, even if it feels mild or is mistaken for indigestion. Symptoms like jaw pain, nausea, dizziness, or cold sweats are also worth reporting, as they might indicate heart disease. For those who snore loudly or wake up gasping for air, consulting a sleep specialist to rule out obstructive sleep apnea is critical. Women, in particular, should be vigilant about unusual symptoms such as back pain or extreme tiredness, as these may be overlooked as heart disease signs. If you notice memory problems, trouble concentrating, or frequent episodes of brain fog, especially with other risk factors like high blood pressure or diabetes, it's time to seek medical advice. Early evaluation can lead to timely interventions that prevent serious complications. Don't wait for symptoms to escalate. Addressing them early can make all the difference in maintaining heart health and overall quality of life. In conclusion, heart disease is often a silent threat, developing without obvious symptoms but presenting subtle clues that are frequently overlooked. From shortness of breath and fatigue to snoring and memory problems, these signs are often dismissed as minor or unrelated to heart health. Women, in particular, face unique challenges due to atypical symptoms that are easily misdiagnosed. Understanding the link between snoring, unexplained tiredness, and cognitive decline with heart issues highlights the interconnectedness of our heart and overall health. By recognizing these warning signs early and seeking timely medical care, we can prevent complications and safeguard both heart and brain health. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.